Providing quality oral health care for children in need, specifically in underrepresented or underserved communities, is a noble mission, and for the folks over at Teamsmile, they're 100% committed to providing life changing dental experiences through the power of sports. John McCarthy is the organization's executive director. He joined me this week to discuss the good work of his organization and how the power of partnerships is allowing them to climb mountains of hope and put smiles on the faces of countless of deserving kids. I'm Kevin McShad. Let's have this conversation. Fantastic, John. I want to welcome you to the show this afternoon, and I want to thank you for your time to join us to talk about Team Smile. So great to see you this afternoon, and thanks so much for being here.
It's a thrill to be on with you, Kevin. Thanks for having me. It's a real thrill.
So I know the mission of Team Smile is to provide life-changing dental care and experiences to children through the power of sport. So could you tell me a little bit more about that?
Yeah, Dr. Bill Bush and Jason Krause started this in 2007, or the first program was with the Kansas City Chiefs. And in essence, what we do, we combine work with professional sports teams in the NFL, the NBA, Major League Baseball, a little bit of MLS, a little bit of NHL. We'd like to do more in those realms as well. And we set up these huge dental clinics in stadiums and arenas throughout the country. And it is just really neat when you see all the magic happen, so to speak, when you have the combination of players, cheerleaders, mascots, a DJ, face painters, and you're in Fenway Park, you're in the Superdome in Louisiana, you're in Mercedes-Benz Stadium in Atlanta, Arrowhead Stadium in Kansas City, and on throughout the country. We're in some of the finest stadiums and arenas in America, and it's just a thrill. I can go on and on. You want to go to Lucas Oil Field in Indianapolis, or we go up to Minnesota to Target Field, and on and on. There's so many great stadiums and arenas, but to bring these kids out that in a lot of cases just come from nothing, and to give them this special experience. And what we try to do is make dental care cool, make it fun, take the fear out of it for the children. And by combining with sports, we're able to do that. And one thing that I want to highlight is that from the core of what we do clearly is free dental care and oral health education for children in need. But a lot of people, I think, have the perception that, oh, we do screenings or we do cleanings. Well, we do screenings and cleanings, but we do the full body of dental work right there. If a child needs to have a cavity filled, a tooth extracted, a root canal, we do it all right there on site. We have high-tech equipment, and we're able to provide an awesome experience for them in a really special location and provide the dental care that they sincerely need.
And I know that a big part of your business model or organizational model is the power of partnerships and collaboration with dental professionals and athletic organizations. So could you tell me a little bit more about the inroads you've made from a partnership perspective?
Yeah, that's a great point. I appreciate the question, actually, because for us to work, for our model to work, we really count on, quite frankly, the combination of multiple factors coming together and multiple groups of people. One are professional sports teams, of course. Two are volunteers. Each program, we're going to have between 125 and 150 volunteers. That consists of dentists, dental assistants, dental hygienists, and a lot of general volunteers. And then we're going to need schools, indoor boys and girls clubs to bus children in or to be part of it. So we need the combination of children slash schools. We need the combination of volunteers and dental professionals. We need the assistance of professional sports teams. And we need all those things to align, so to speak, to run our programs. And so we're, quite frankly, we're quite dependent. We're very volunteer driven. At Teamsmile, we have a grand total of 8 people between full and part-time. But last year in 2019, we incorporated over 4,000 volunteers throughout the country and served over 7,000 children throughout the country with only 4 full-time and 4 part-time people in the office. So we are very, very much volunteer-driven organization.
And I know that certainly when we look at minority communities, because of a lack of resources or just not having the infrastructure to service those, that demographic can be a challenge sometimes. So I'm sure that you can make a big difference in that segment of the population as well, correct?
We absolutely do. We absolutely do. And in general, as a broad statement, we target children in need. We target boys and girls clubs. We target schools that are high and free and reduced lunch. We target schools that have a Title I schools. So basically children in need. So regardless, quite frankly, whether you're white, black, Asian, wherever you come from, we want to help. We're there to help. Now, we do end up serving, quite frankly, a good portion of the children that we serve are minorities, whether that is black, whether that is Asian, whether it's Latino. Quite frankly, we serve a high percentage of minority populations, and quite frankly, we're really proud of that. We're very, very fortunate to be able to make a difference where there's a great need.
And I'm curious, what do you think has been the largest or biggest impact the organization has made since you've been their executive director?
Well, it's probably a combination of things. Our numbers, statistically, since I've been here in roughly 3.5 years, we got to the point where we have tripled the revenue into Teamsmile. And where that's significant is we're a nonprofit organization. But the more money we're able to raise, quite frankly, the more impact we're able to have. And therefore, the number of children that we're able to serve went from 3,915 in 2017 to over 5,400 in 2018 to over 7,000 in 2019. So in terms of the volume of children that we're able to serve and the number of markets throughout the country we're able to serve has significantly increased. And our organization now is quite stable. We have the right people, the equipment in place, and we build an infrastructure with teams, with volunteers, and with partners. Quite frankly, one of the things that's really important for us is the fact that we've got 9 national partners right now and a couple other major insurance companies that are part of Teamsmile. So we've become stable, and we're able to significantly increase the number of children that we serve and the number of markets we serve throughout the country. We are going to continue to increase the depth of which we're able to serve people both on site and after the programs for ongoing care as we move forward. So we're going to be able to increase the depth in the coming years as well as our overall numbers, which we're very proud of.
And I'm also fascinated to get you to comment on, because I know one of the biggest parts of your organization is to also empower kids to take charge of their own oral health care. So what would be your message to kids about the importance of good oral health, and secondarily to their parents as well?
Yeah, Kevin, that's something that I've learned since taking this role. Obviously, I think as an adult who's had a couple very good parents and good role models throughout my life, I've learned the basics, but I've learned that how important it is. Your oral health is linked to heart disease. Your oral health is linked to diabetes. Your oral health is linked to your overall health of your body. And so, therefore, the more you start to learn and the more you start to realize the links between oral health and overall health, the more you start to realize the importance of oral health in a child's life and ultimately in everybody's life. And so, therefore, it's really important is the educational component of what we do as well. Obviously, I touched on the exciting parts, the professional sports and stadiums, and the core of what we do is provide uh, free dental care and oral health education, which is really important. So when a child leaves, they may have their cavities filled or a tooth extracted, they get their cleaning, they may get silver diamine fluoride, they're well taken care of on that day, which is wonderful because in a lot of cases, it may be the child's first dental experience or a fairly rare dental experience. So it's really important what we do. But what's also really important is that they learn how to take care of their teeth and their oral health education. So we spend quite a bit of time with some of our partners from Colgate to DentaQuest and others, helping to educate them going forward, educate their teachers and educate them while they're on site so that they have great information. And we put educational materials in their bags as well. And we have recently created and we'll launch here shortly an educational platform on our website. And we're in the process of finalizing a couple new educational videos as well. So that education component is really important for the ongoing care beyond our programs that day.
And I know I asked you earlier about the impact you've made since being executive director, but I'm also curious to know what do you hope your legacy is during your tenure of leadership for the organization?
To be honest, we've been so immersed. I've been thinking as I'm picking up more gray hairs in general in life, I've been thinking about legacy a lot more than I used to years ago. But I really haven't thought about a whole lot of it as it pertains to Team Smile just yet. And I think the reason for that is from day one, I just got immersed in the process of our programs and everything it takes to make an impact one child by one child. But as you ask the question, the first things that pop to mind is that this when that day comes that John McCarthy moves on, whether it's in 5 years or 10 years, or when it's that day that I head to my grave, I want to make sure that Team Smile, uh, a couple things. One is stable to continue well on beyond me. I think it's really important that Team Smile is not about John McCarthy. It's not about individual people. It's about the impact that we make one child at a time. And over the course of the coming years, we'll pass different milestones. We'll pass 60 and 70,000 children that we've served, and we'll eventually pass 100,000 and on and on. But one by one, being able to make a difference one child by one child. And I want to make sure, though, really, it's not about me. I want to make sure this organization is in a stable financial position, has the right people in place, and is set for continued future growth and future impact. But I want people to remember it's about the children that we serve. It's not about me. To be honest, it's not about anybody else that works for our organization. We are vehicles. We're vehicles to help children in need. And if we remember that, I think the rest begins to take care of itself. If we focus on making a difference for children, and that remains our focus. I hope that my legacy is such that people look and say, he made a difference. He made a positive impact on the lives of children.
And how, if people want to get involved with your organization, how can they do that?
Yeah, so go to teamsmile.org and shoot us an email at info@teamsmile.org. And whether you want to volunteer, if you're interested in helping with a fundraiser, if you're interested in donating, if you want to know about where we have our programs throughout the country and you're interested in coming out and seeing what we do, if you're interested in sponsoring an event, contact us, info@Teamsmile, or contact me directly at john@teamsmile.org. And I'd love to point you in the right direction on how you can help and what your role may be going forward. But as I mentioned, we really rely on our sponsors. We rely on our volunteers, and we are incredibly grateful because, quite frankly, if we don't have sponsors for our programs, and if we don't have national partners, and if we don't have volunteers at our programs, if we don't have children, then we don't have Teamsmile programs. So we are incredibly grateful and reliant, quite frankly, on our volunteers, and we're very much reliant on others outside of our staff to make the magic happen, so to speak.
And I'll close with this. Just before this started, you had mentioned your enthusiasm or former life in the sports realm. So as a former sports reporter, I'm just wondering where your passion for sports comes from.
I think that's been a lifelong passion. Like a lot, grew up playing football, basketball, baseball, soccer, et cetera. And over the course of the years, I realized some of my great influences in life were my parents and coaches from the time I was very young. And I developed a real passion for sports, eventually football, basketball, et cetera. But just in general, I love the passion and the emotion that sports brings out in people. And I've had a lifelong passion for sports in general. And so I appreciate you asking the question, because I've had the fortunate opportunity to kind of run the gamut through collegiate athletics, from assistant coach, head coach, athletic director, commissioner, founder of a number of national events at the collegiate sports level. So it's been a real thrill for me. So I sure appreciate you prompting the question. Thanks, Kevin.
Fantastic, John. I want to thank you for spending a few minutes with me to talk about Teamsmile and all the great work that you do. Thanks so much for your time, and have a great day, okay?
Great. Thanks so much, Kevin. You do great work. You're a great inspiration. Thanks so much.
Well, thanks for the